You have probably already heard of Damar Hamlin's in-game collapse on Monday Night Football. In this video, I'm going to walk you through a common sense approach to what may have happened and talk about the most likely diagnosis. Spoiler alert, it's not related to vaccines. This is most likely commotio cordis, an extremely rare diagnosis that you typically only read about in textbooks. Welcome everybody, I'm Dr. George Guo. On this channel, I try to teach you about what happens in the emergency room and give you some insights on how doctors think about medical problems in everyday language. As you can see, Damar Hamlin takes a direct hit right into the chest. Hamlin stands up briefly before collapsing to the floor again. In the emergency room, this would be characterized as a blunt force chest injury leading to a traumatic cardiac arrest. In the chest, there are three main things that can be damaged by trauma: the lung, the heart, and the aorta, the large blood vessel that comes out of the heart and feeds the entire body. A tear in the aorta will result in immediate death. Most victims die almost instantaneously. No amount of CPR will bring back someone from that. This is less likely to be the case for Hamlin. Next up is a tension pneumothorax. That usually happens from a stab wound. The punctured lung leaks gas into the chest cavity that then traps it. This trapped gas builds up and completely collapses the lungs and crushes the heart. Again, less likely to be the cause. Now we arrive at the heart. The heart is surrounded by a membranous sac. If the heart is thumped hard enough and starts bleeding into this impermeable sac, the pressure from the trapped blood accumulating around the heart ends up crushing it. This phenomenon is called cardiac tamponade. In this ultrasound of the heart, you can see the heart uselessly trying to beat within this dark pool of blood, slowly forcing its walls inward. Blunt trauma can also rupture the sensitive valves that prevent backflow of blood within the heart. Again, no amount of CPR or electric shocks will bring back someone from either of these. In both valvular rupture and cardiac tamponade, immediate surgery is needed. This is less likely to be the case again here. That leads us to the most likely cause of Damar Hamlin's death, a type of electrical short-circuiting. This is called commotio cordis, and it represents an interruption in the normal electrical activity of the heart due to blunt force trauma. You need two things for this problem to occur. Number one, a strong enough force, and two, just the right timing. This is the standard electrical signal of the heart. You can see how the heart beats with each large spike in electrical activity. Notice the T wave. This is the period of repolarization when the heart resets. When blunt trauma occurs during this period of reset, it can be thrown into cardiac arrest. This window is merely 20 milliseconds long. Being hit anywhere else during the cycle does nothing. If we take this rhythm as an example, that 20 millisecond window corresponds to about a 2.5% chance of dying when hit. What that means is when someone is hit in the chest with enough force, 97.5% of the time, they would be just fine. In that moment Hamlin collapses, his heart rhythm would have looked like this. In that moment, his heart would have looked like this. A quivering heart does not pump blood forward at all. That means with each second that passes, none of his organs were receiving any oxygen or nutrients. This is the state known as cardiac arrest. Medically, when you are in cardiac arrest, you are dead. In this state, brain cells start to die. Brain damage starts to set in at 4 minutes. At 10 minutes, this damage becomes irreversible. Damar Hamlin was in this exact state. No pulse, no flow. The only way to save him is to restart his heart. CPR is done to manually pump the heart from the outside. It's important to do this continuously because the moment you stop, blood stops circulating once again. Next step is to get defibrillation pads on the chest and to shock the heart back to a normal rhythm so that it can resume pumping once again. Medics do the above and manage to restart his heart. At this point, he is rushed to the hospital. There, they intubate him and place a tube into his throat to take over his breathing. Hooked to a ventilator, they can begin the careful process to assess the extent of organ damage and begin the slow process of recovery and rehabilitation. At this point, some centers will initiate a hypothermia protocol. By cooling the body, it is theorized that the brain has a higher chance of recovery due to the reduced metabolic needs and reduced swelling. Cardiac arrest is no joke. At this point, we can only wish Damar Hamlin and his family our best. I hope this sheds some light on the tragic nature of these events and goes to show just how fragile our bodies really are.